No, I wouldn't have been as nice. I would have been more demanding.
He's so mean. He's so mean.
Okay, so now I'm recording. So the clinics of North Texas are in the process, it's not final yet, but they're in the process of becoming a clinic for the DPC, Direct Primary Care Services. And Eric, what that means is healthcare to you is DPC, Direct Primary Care. So you can go to one of their doctors for $10 for acute treatment. So acute means illness or injury. And you can go to one of their clinics for $10, regardless if you have health insurance or not, with which clinics of North Texas does have health insurance. But direct primary care is included. There's a wellness element with ID Life, which is there's a folder or a file here as well. And there is a tax savings. So the way it works is if the employee chooses to sign up for Healthcare to You, which is the package, it also includes telemedicine and no charge for the entire family. If they choose to sign up for that, the federal government under Section 125 allows them, it's a subsection of 125 called 105, and it allows for employer reimbursements for wellness. This product falls into that category. So the way that it works is, and I'll show you in the system here, but the way that it works is if you say, Eric says, yes, I want to sign up for the program. How much is my tax savings going to be if I enroll in the program? Let's say it's $100 per pay period. So I have $100 per pay period that will be a pay raise for me come January 1st. Or I can spend some of those dollars or all of those dollars on benefits. And in this case, we're talking about voluntary benefits. The Chubb and the Bankers Worksite and Kemper. So that's kind of high level, 50,000 feet, how it works. All of the actual descriptions are in these documents though. The script is very handy to have. It describes everything in detail. Let me just open it. Here it is. This is an employer-paid program, which is true. There's an employer contribution to this. Employer-paid program, but participation is voluntary. If you enroll in a program, you receive unlimited doctor's visits for acute care, chronic disease management for 13 diseases, $10 copay or visit, $10 fee per visit. You'll also receive telemedicine, no copay for you and your family. And then this is the explanation of how this works and how it's legal and all that stuff. It allows for rewards of incurred medical expenses and health plan premiums. That's how. So what happens is, let's say the cost for the program is $500 a month. You're going to have a $500 monthly deduction from your paycheck, but your employer is going to reimburse you the $500 back in your paycheck simultaneously. So for you, there is no negative effect at all. In fact, there's a tax savings that's generated from that transaction of $100. And so everybody wins. The employer has some tax savings. You have some tax savings. You can spend the money or keep the money or whatever you want to do. And oh, by the way, you have access to direct primary care, telemedicine, and a wellness program if you want to use it. You don't have to, though. So it's literally a win-win across the board. So the script is very helpful there. There's a frequently asked questions. There's a Healthcare to You difference because some people have heard of programs like this, but Healthcare to You is completely different from them. You probably won't run into that. You probably won't have anybody that knows about a program like this. And there are some other things. So let's just look at this page for a second. So we have there's a cheat sheet here, there's a script here, frequently asked questions, the difference. This is all these are all your study materials. This is not available to employers or to the employees. This is just for you specifically. HC2U enroller. There is an acknowledgement form. This is a paper form that when you're enrolling on site, the employee needs to sign if they sign up for the program. And it says, I get it, I am signing up. I'm not automatically enrolled. I have to actually go through the process. I sat with Eric Weidenbach, went over the plans. He described everything to me. Here's my name, signature, and date. We're going to have the employee fill this form out, and we're going to retain this form because I want them back here at Benaware. Do not give them to the employer. The other unique thing is, and the reason that this form exists is because we've had enrollments that we've done with this product before where employees come back and say, well, they didn't explain it to me properly. Disenroll me. Well, you can't. It's a Section 125 program. You can't disenroll unless you have a life event. So this is a cover our ass move by creating this form. The second thing we do a few things. The second thing we do is when you go into the system, when you go to log into the system, you're not going to log in as an admin like you normally do. You're going to log in as the employee. And we're going to go over that here in a second. The reason is that they can't come back and say, well, I didn't sign in. They signed in for me and did the enrollment on their own. I wasn't even there, because that's happened before. Not with us, but they had that experience before at Healthcare to You. So those are two things. The third thing is for Eric, Eric Braxton, our call center person here, is that Eric records the summary of the Healthcare to You enrollment so that we have that evidence. Since we don't have the physical form, we have a recording that says, yes, I did enroll in the program. So you shouldn't have to do that, but with programs like this that are kind of difficult to understand, we have to make sure we watch ourselves.
So, Scott, is it necessary for me to enroll as the employee as well?
Yes. Yeah. You need to log in as the employee.
Okay.
And then, so that's the acknowledgement form. And what we're going to have to do, Olena, when you get there, you're going to have to go to Kinko's and print 250 of these or something like that, because pretty much when explained properly, 90% of the employees are going to sign up for this thing. And out of that, 95% are going to spend most of their money, their tax savings, on voluntary products. That's just how it works. So we probably need 250 copies of this page. The other thing is Healthcare to You is delivering this flyer front and back. Let me just open it for you. So this is the front. Welcome to Direct Primary Care. This is if they sign up, obviously. This is what you get with it. There's the 800 number. You can't just make an appointment with clinics in North Texas and get in and use this program. It doesn't work that way. You have to call this 800 number. They will schedule you the appointment for you. Same day or next day, but they schedule it for you because they have the fee arrangement with the doctor. You don't have an ID card that says, here's my $10, it cost me $10. It doesn't work that way. They have to call the number. They'll verify they're a member. They'll set up the appointment for the employee. They'll handle it all. The back of this page has a diagram that shows the comparison of two paychecks. So a normal paycheck without Healthcare to You enrollment, and one with. So, and this is a leave behind flyer. You're going to use this for the employee. So amount of taxable income, you can see it hang on both checks. Taxes paid, you can see that there's a reduction in the taxes that you pay when you enroll in the program. That's the whole point. Contributions that reduce taxable income, which you don't have any today, but you're going to. So I said $500, pretty close. $498.46. In this case, the price is different from employee to employee because it's based on their salary. And in this case, they didn't buy any voluntary. Over here, they did. And the net pay here is $1,415 versus $1,453. So they had a tax savings that was generated by this. They purchased two voluntary products. They still ended up with a higher paycheck than they had before. And there's just a picture of a paycheck. But this, between logging in as the employee having them sign the acknowledgement form, giving them this that explains exactly what their paycheck's going to look like, or a sample of what it's going to look like in the future, and Eric recording the calls, we are totally covered. So, well, we shouldn't have to, but we have to. So that's what we're going to do here as well. And then you can look at this other stuff on your own time, but that's the link that I put in the training invite there at the top there. Now at the bottom, I have the link to enroll. Let me just open this. And this is the one that is specific to logging in as the employee. So it says enrollment site. The other one said admin site. So you know you're on the right page if you click enrollment site. And Christina, we set this up for self-service.
Excuse me, one time.
Have you set this case up for self-service access?
You know, I will look on the back end right now for you. Hold on.
All right, and the employee ID or social, we're going to put the full social of the employee, or you can have the employee do it, which is probably better. Can you please type in your full social with no dashes? And just type it in. And then the PIN code is the last 4 digits of their social and the 2-digit birth year. So 555575 is an example. That's how you access the system. So Christina is setting it up for self-service so we can access the system
It is
that way.
set up now. Set up now. That's good.
Enabled the PIN codes and everything.
Yes.
So I'm going to go on the admin side just so I can show you this thing. Clinics of North Texas. You might have multiple cases like I do. When I go to enrollment and employees, when I pick an employee here and I go into the employee, I'm going to reset it here. You're not going to see any of this. When you log in as the employee, the first page you're going to see is this next page here. This page. Welcome to your enrollment for 2019. Healthcare to you, direct primary care, ID Life, which is the wellness portion. They're tied together. The tax savings, all three of these are tied together. If I enroll, I can spend my dollars on these benefits. If I don't enroll, I can still spend my money on these benefits, but I won't have any tax savings to spend it with. One thing we're still missing is Chubb has some products here that are not displayed yet. They're in the process of building them. Christina, did we get a timeline on when to expect that?
Actually, I just got an email back that I want to discuss with you after the call. You're CC'd on that, because I think there's a couple of changes, but I think they're working on it, and they should have it done pretty quickly here.
Okay. So I had to put in, we got dependents. That's awesome. One thing that is important is dependent socials. It is a requirement that if they're going to enroll in Healthcare to You, the dependent socials are captured. And I believe, Christina, you mentioned that in the flyer, didn't you?
Yes.
All right, so they know to expect to have that stuff on hand. So how do you add it? You have to go. So we have dependent information loaded, but they didn't give us the dependent socials apparently. So you can click on the pencil, which is the edit button, and add it in. Right there.
And it should make it so you can't even go past that screen without capturing it, because we have it as required.
Well, let me try. I think it'll let me pass this screen. See, it did.
But it won't let you enroll in any benefits.
Well, we'll see. All right.
So yeah, please check, because I just looked on the back end.
So wellness, this is the video. This is a 4-minute video that is here. And Olena is going to be, the broker will be in attendance day one to do group meetings regarding core benefits, because they're doing core enrollment on ADP, and they're doing it self-service. It has nothing to do with us. We don't need to know anything about the core. Alina will also be there to do a little powwow on Healthcare to You, to explain to the employees what it is, how it works, etc. If she's able to show this video at that time, that'll save you 4 minutes. If she's not, then you'll have to show it to the employees. So there's that. I'm not going to play it. It's in the training documents as well, but it just gives high-level info. Now, we've programmed the system to embed parts of the script as well. So you don't have to read it verbatim, but it talks about what the plan is. Employer paid program. This is very familiar, right? This is directly from the script. Participation is voluntary. 13 chronic illnesses, $10 per visit, etc. How it's allowable by the IRS. By enrolling in the program, you're going to see from your paycheck a pre-tax taken. The DPC program is taken from your paycheck on a pre-tax basis, and then simultaneously earn a reward/reimbursement, an offset by your employer for this expense. So the employer puts the money back in. That process generates tremendous reward/reimbursement for you. The dollars can be used to purchase your choice of supplemental health benefits. You are not required to spend all the funds on the benefits. Some other companies make you spend all your savings, but not this. That should look familiar. That is the flyer that they're going to get. Did you watch the video in its entirety? If they saw in the group meeting, that's a yes. If you had to show it to them, that's a yes. It has to be a yes. They're required to watch the video. So this is direct primary care. So again, we have a summary, just like we had on the previous pages. And then now in this case, we have received some data here. We know that the filing status is married. So you don't have to do the drop down. Okay. This data was provided from the employer. If it's not correct, you can change it, but it's already there. And it's already built into the calculator as well. Number of allowances, that's already populated as well from the employer, from the W-4 form the employee filled out when they got hired. That's where that comes from. Tax deferred plan, tax deferral plan like a 401k or anything pre-tax they're contributing to, we didn't get that, so that's a percentage that you drop in there. And then local state tax, there's no state tax in Texas, so that's 0. Now, this is where people get a little confused because normally, it's next. I want to enroll, I want to pass. But on this one, you want to definitely show this. Once I've completed my values here, it says to review your excess tax savings, click here. This opens a pop-up window that shows for this employee, without Healthcare to You, this is their paycheck and their taxes. This is not benefits. It's just showing the taxes that they pay today and the net take home based on that. With Healthcare to You, just like the paycheck comparison on the flyer. With Healthcare to You, here's your starting pay. Your taxes are reduced. There is the Healthcare to You cost, which is $290. There's the reimbursement. And there's an excess tax savings of $18.68. If I say I want to enroll in this program, I'm going to have $18.68. Let me say this very slowly. Per pay period to spend on benefits or to increase my take-home pay. After the effective date. Either one. So I still haven't enrolled in the program. This is decision time. Would you like to enroll or not? If I say yes, I hit apply. If I say no, I hit decline. So now I'm enrolled. Here's a flyer on the ID Life, same one that's in your little web page there. ID Life Wellness is included. So because I enrolled in that, then this is already included. There's no cost. It's all embedded together. You will see a deduction in your pay. They want to drive home the fact you're going to see a deduction. There's going to be a reimbursement. Don't freak out if you see $190 come out of your paycheck. We already told you it was coming out, first of all. And secondly, here's a reminder. you're going to see a reimbursement from your employer on an after-tax basis. Illustrations on the next page. This is the back of the flyer. This shows a comparison paycheck. And there's the tax savings. Now it shows up as a negative here, $18.68, because if you buy any of these products, it's going to spend down the dollars. And the only way to display it is in a negative. You just hit next. So you have the banker's accident plan. If you want to enroll, it's $9.79. You have $18.68 to spend. You don't have to get it, but if you want to, go ahead and get it. Beneficiary. And you'll see now that I have my $18.68. I spent $9.79. I have $8.89 left. Pretty simple. Kemper Cancer Plan. Do I want cancer? Sure, I'll take the cancer plan. I've got the money to pay for it right here. And now I have $2.43. Now, if I keep going and I get the critical illness, I'm going to exceed how much money I have to spend. But let's go ahead and do it, and I'll show you what happens. Beneficiary. So what happened? So I have $18.68 to spend. I spent this. I have exceeded how much I had to spend. So I now owe 90 cents. There's going to be a 90-cent deduction out of my paycheck after the effective date. I can keep going, or I can stop. Or I can go back and change it, and whatever. You can do whatever you want. That's the idea. Now we've got a list of products here. We've got the accident, the cancer with Kemper, critical illness. Bankers also has a cancer product as well. And then there is life insurance and hospital indemnity with Chubb. And like I said before, they're still building that. So you should spend every penny of everybody's cash that they have easily. Also, this is an Aflac takeover. So this is the latest Aflac bill from September. And it identifies by name who has what coverage. You will definitely want to have this handy with you. You don't have to print it or anything, but you can do. I think you can. Well, it is a PDF. Let me see if I can do a Control F search. Okay, no, you can't do a search that way. But they are alphabetical, as you can see. So it is 13 pages, but you can scroll through and find the person, see what they're enrolled in. And the key here is make sure that they enroll in these products first, because that's all we need later is to say, well, I had the short-term disability, why don't I have it today? Well, let's just make sure we get them enrolled in those products that they have today first, and then go on from there. So anyway, that's a side note. But anyway, you enroll in the product, you decline the product, you keep going. And I either owe money or I don't. Or I owe money, it's break even, or I'm getting some back in my pocket. This is the sign and submit page. So if I want to make changes, I click on these links here. You have to check these boxes for the employee. See, it says employee. You're signing for them electronically. There is the confirmation form, breakdown of everything. Notice the healthcare to you cost is in here, $290. This couldn't be more crystal clear to people. It's right in your face. It's $290 is what you're going to see in your paycheck, and you're going to see a reimbursement. We got the critical illness, the accident, so on. And I owe 90 cents per pay period, which is pretty damn good. I got 3 products that aren't exactly, I got 3 good products. I only owe 90 cents instead of owing, $15 or $18 here per pay period. And then I sign it. You're going to sign it with their PIN code. The last 4 of the social, the 2-digit birth year is the signature. I'm going to sign it as the administrator here, but that is the process. Now, Christina.
Yes, sir.
Is this one set up for email confirmation?
I was just checking with Davey on that, sir. So I believe it is because we had discussed it, but I want confirmation before I say 100%.
So it was requested to be that way?
Yes.
Okay. So the employee is going to get an email confirmation. They're going to get this confirmation emailed to them. It does take a little time, tell them 24 hours, but they'll get an email confirmation with their elections. Any questions about navigating the system? Okay, good. Or bad or not good or whatever. So we went through Healthcare to You. It's direct primary care. It's telemedicine. It's wellness. You can participate or not. We don't really care if they enroll. We don't care. It makes sense for them to enroll. They get access to all these great things. They get a tax savings that they can use to increase their paycheck or to buy some products with. It makes total sense, but we really could care less. We're not pushing it on them, necessarily. We don't push anything, if anyway. So anyway, our history has been that 90% sign up, 90+% sign up, and that 95% are going to spend all of their money on products. So don't forget to refer to the Aflac statement, though, that has what they currently have. Let's start that as a starting point to make sure that we get them enrolled in what they should be. All right. And then we have products. I included the proposals for the 3 carrier that are being offered here. This is the Kemper Cancer product. We don't have to go into all the details here. This is a 12-page document, and the other ones are even bigger. The difference with the 2 cancer products, you might say, why are there 2 cancer products available? Why is there one with Bankers, Christina? Can you mute yourself?
Excuse me? Did you?
You're typing. You're banging. You're worse than I am.
Oh, I'm sorry.
So why is there a Bankers Cancer and why is there a Kemper Cancer? Scott Reynolds, what the hell? Well, here's why. The broker and the client want to have options for their employees. There's currently a cancer product with Aflac, and they like the cancer product. They are in the medical field, so they want an option. So this one works on a piecemeal basis, as you can see. There's a piece here, there's a piece there, and blah, blah, blah. The other product works more like a critical illness plan where you get a lump sum payment. So there's still 2 standalone cancer plans, but this one, the Kemper one, works on a piecemeal basis as you're having treatments done and so on. And the Bankers Worksite product works on a lump sum basis. This is the proposal. One thing I want to clarify, this says accident, critical illness, and whole life. This life insurance with Bankers this is not the final. They did not go with the whole life with Bankers. They went with the life insurance with Chubb, which is what you're going to see in the system once they build it. So disregard that part. They just didn't bother, because of timing, they didn't bother issuing a new proposal. So it's just the accident and the critical illness. There we go. So accident. This is the accident plan. It is 24-hour coverage. Let me make this thing bigger. There we go. 24. It says 24 or off the job. I think we have to check on that. Well, we'll see. Benefit amounts. This is very generic. Oh, Lena Reynolds. You went through this earlier today. You need it is 24 hours.
Works a little bit different. Yeah. Normally we have a schedule of benefits, like piecemealing, when this happens, this is how much you get. When this happens, that's how much you get. That's what we used to see. This one is $2,000 maximum benefit per year. And I guess they're just going to keep reimbursing you until you hit $2,000 after accident.
As long as it's an
Ambulance, ER,
accident-related expense, right?
accident-related expense, yeah.
$50 wellness rider.
And then
It refers to deductible and coinsurance because some policies with bankers do have deductible and a coinsurance you have to hit first. It's not the case here, though.
also kind of a different thing was children coverage. If you have like more than 2 kids, the plan is only going to cover 2 times the amount, the max amount, so $4,000 on kids. So whether you have 10 children or 3, the most, and everybody gets in an accident, the most they're going to pay is $4,000 a year. It was a little bit on like first page, I think. You just scroll up, you'll see it. Right, let's see what.
I don't see it.
Their family coverage. Oh, maximum benefit.
This?
Yeah, maximum benefits for dependent covered children combined can only equal twice the policy year max for single dependent child. Right?
Okay. Critical illness. $5,000 to $50,000. Now we have it set in the system to be captive guarantee issue. Rider. Yeah, I'm not sure. This is very generic. Jesus. Let me go back here. $10,000, $20,000, $10,000, $20,000 guarantee issue. So you select the tobacco products, tobacco status. You select 10 or 20 and the rate.
And do we know if it was HSA or the other one, the HSA compatible? There's a little bit of a difference in what.
Here's why. The worksite products with healthcare to you is involved. The worksite products are post-tax. They're post-tax. They have to be.
Mm-hmm.
So I don't think it's the HSA compatible one. I've got some questions on this myself because is it $50 or $100 wellness rider? I don't even know. But let me see if it's in here down below. There it is. Dependents get 50% of the employee amount. It is a $50 wellness rider. So what they do is they give you a generic proposal and then a custom one specific to this case. Stupid. And there's the list of benefits.
Yeah, I probably that code over there, Form B21603 GMP. And then when you scroll down,
that's 20,000. They're also delivering brochures on site. All the carriers are delivering brochures. Healthcare to You is delivering those flyers with the front and back thing. And Alina is going to have to print up some of those authorization forms. Okay, so 10 and 20, $50 wellness, 50% coverage for dependents on the critical illness, and the rates are in the system. Good stuff. Whole life, again, was not part of the proposal. I mean, initially it was, and then they changed it. All right, Chubb products, 44 pages, good stuff. You don't have to do all this, but we have the accident. So with Chubb, it is it's not critical illness, it's accident, hospital indemnity, and the disability. 3 products. So Chubb is building out the system right now. We can't look at the system, but there's a high and a low plan. This does work on a fee schedule, as you can see. Actively at work. Critical illness is not part of this. I hate the way they do this. They give you a generic proposal with all of their products, and then it's just pick and choose which one. This is hospital indemnity, $1,500 or $2,000 admission, and then the daily benefit, $150 or $200. I wish people wouldn't sell hospital indemnity. People just don't buy it. Period. They just don't buy it. We have a hard time hitting participation with this product, with any carrier, especially when there's a lot of products offered like this one. So disability, to your own total disability, non-occupational, off the job, 3-month benefit period, 7 or 14-day waiting period. You'll see a 773 and a 14-14-3, $3,000 guarantee issue maximum. The system won't let you exceed that. And that's it. It's disability. Again, we got to put something in place to take over Aflac. And then they have life with Chubb as well to replace the whole life that's in force with Aflac. It's a term life product, but it is a permanent product. Covers through age 120. So here it is. Guarantee issue of $75,000 on the employee. CGI is 125. So if they wanted a higher amount, there's going to be a couple questions. And then simplified issue is 225. But again, you don't have to know all this stuff. It's in the system. If it requires questions, then they will come up. That's it on that. And the Aflac. So we have whole life, cancer, STD, hospital indemnity, and accident. I don't think, yeah, they did have critical illness too. That's why there's so many products here, because in typical Aflac fashion, they load them up with everything. And that's what happened. But with Healthcare to You being part of the thing, and with them having free dollars to spend, we should have no problem replacing all this stuff. And the amounts you see here are monthly also. All right, so we're on, Christina checked with Chubb this morning to see what the status was of the build. Obviously, it needs to be done this week, before Monday. Setting up the self-service, we're enabling the email confirmations. All the forms have been delivered on site, not forms, but the flyers and the brochures have been delivered on site. I think one of the carriers, Christina, didn't one of the carriers even kick in some pen?
Excuse me?
Didn't one of the, stop timing.
I'm not typing. That's not me this time.
Sorry.
That's Eric Braxton.
Some giveaway.
Do it again. I can't hear you.
Didn't one of the carriers kick in some giveaways?
Yes. I believe Kemper, there's going to be a couple of them, to be honest. I believe Kemper is doing some pen giveaways, and I want to say Chubb is doing something. I'll be able to confirm for everybody in an email after this call. I'm actually about to get on a combined billing call with them, so I'll be able to let everybody know what to look for when they get there.
Okay. I'm pulling up the schedule here. So there are 2 locations. Whoever, I think, it doesn't really matter who goes to the second location, but you're both going to go at some point that day. Now, the lunches are different because of the hours. They close at 3, that location. So it's going to be a little tight seeing everyone in that time frame, but I think you have enough time. So the first day I want to point out is 7:30 to 4:30. The other days are 8 to 5. Okay. And it has to do with the fact there's going to be a group meeting first. So the first appointment on Monday is still at 8 o'clock. Okay. Same thing all the way through. The addresses for these 2 locations are on tab 2. That's the main location. And your contact is Allison. She's the HR person. Real nice lady. And there's her phone number. In case something happens, of course, I want you to call me first. But that's the schedule. Pretty cut and dry. There's 2 locations, one big one, one small one. And that's it. I mean, they're doing paper sign-up sheets. Christina sent them the sign-ups just today, I know, but we'll get them filled out. We'll push them to get those all filled out.
I did ask them to complete at least Mondays, fill that one up completely, and get that back to us by Friday, if possible, so we could get at least a copy of those to you guys immediately.
Okay, good. And that's about it. Now, Olena is arranging hotels and everything. Olena, did you make Eric's travel arrangements?
Yeah, just the hotel so far. He's driving his own car, so yeah, I think that's it. Yep. Just hotel. I have a flight, obviously.
Right.
Yep.
Okay.
Eric, did you get it? Did you get confirmation?
Eric Weidenbach.
Can you hear me?
There you go.
Are you able to hear me?
Yeah, I think you were muted before. Go ahead.
Yeah, that's why I clicked on it. I'm not aware of a confirmation. That does not mean I didn't get it or you didn't send it.
Okay, I'll send it again.
No, I mean,
No problem.
Is it coming from you or Scott?
Actually, this one was directly from hotels.com, but I'll resend it straight from my mailbox.
No, I didn't get anything from them.
Problem. No problem. I'll send it again.
Okay.
All right, cool. So I think that covers everything. Again, Chubb's got some work to finish building out their products, but the system is ready otherwise. Again, you're going to be logging in as the employee, so just turn the laptop to them, have them key in their social, and then you can take it back and put in the last four of the social and the 2-digit birth year, and you're off and running. You're going to be inside their record, and you just click next, basically. So Eric, I want you to spend some time looking at that link that I put in there, this Healthcare Depot Roller training website. If you have questions, which I'm sure you will, since it's kind of a unique product, please call me or email, whatever.
Yeah, I'm not sure if you mentioned it, Scott, but Eric, just so you know, for the primary care, the doctor visit, that is only available to the employee for the $10 copay, and telemedicine is available to all dependents, and there is no charge for that.
Right. On that $10 charge, that is a fee. That is not a copay. It's not a deductible. It's not co-insurance. Healthcare to You, direct primary care, is not insurance at all. So it's just a $10 fee. That's the name of it. But that's a good point. The DPC coverage itself is just for the employee. Telemedicine is for the whole family. In fact, the wellness is for the family too. They have access to it. I think that covers everything. Anybody have any questions? All right. So Eric Braxton, obviously you're familiar with this stuff. I'm sure you got this down pat. Alina, you've done these enrollments before. You got this. You're doing the group meeting. You're all cool with this. Eric, this is your first one with Healthcare to You, but it's simple, cut and dry. Alina will be there with you. I don't know if you're going to be in the same room or not, but you'll be in the same building at least. And if you have any questions or anything comes up, just let me know. All right. I'll send a link to this video that I recorded here later on today.
Okay. That's good.
Okay, thank you.
All right. Thanks, everybody. Bye.
All right. See you later.
Bye.